us today. She's a human-centered data student at in the Master of Information at the University of Toronto. Before U of T, she received a Bachelor of Arts in Economics from the University of Waterloo. And currently, she has a full agenda. She's a graduate fellow at the U of T Center for Ethics. She's also completing a research internship at the Brookfield Institute, and also working with Professor Beth Coleman on research into the economic, individual, and societal impacts of the pandemic response on cities. So she's going to be sharing that work with us today. And the topic is designing trust in COVID-19 technologies. I also have to say, Kamilah knows the best food spots everywhere in Toronto. So if you're curious where to get the best donuts, she's your person. Thanks so much for joining us, Kamilah.
Thanks so much for having me. I'm going to share my screen. Everybody can see that okay? Perfect. So yeah, thank you so much for having me. Like Loretta said, I'm a master's student. And so the research that I'm going to be sharing with you today is part of a project between the University College London and the University of Toronto. And essentially, we're trying to understand the impacts of technologies in urban centers. Yeah, I'm really grateful to be part of this project, and I'm really excited to share what I've learned over the past couple months with all of you today. So like Lorena mentioned, my topic is designing trust in COVID-19 technologies, and I specifically looked at contact tracing technologies. I kind of began to become interested in urban technologies and how we can make them better when I took a class in the winter term with Dr. Beth Coleman. It was called Data in the City. Highly recommend if there's any other iSchoolers in the audience. And basically what I learned from studying urban technologies in that class, and specifically studying police technologies in urban centers, is that people's experiences with public institutions like the police are very different depending on primarily two things, and that's their race and their income. And so because of the way that these two factors impact your lived experience in a city, I thought it was really interesting, and it could be extended towards COVID technologies as well. So an example that I like to use is in Toronto in particular, some people will go or can go their whole lives without interacting with police ever, or interacting very little. Some people in our city interact with the police every single day, and that very much depends on your race and on your income. And those experiences impact the way that you eventually trust in public institutions. So depending on the way that you're treated by public institutions is going to have an obvious impact on the way that you perceive and relate to and interact with public institutions like police or the government or those kinds of things. And so it turns out that the construct that affects the most is trust, or very much affects trust. And it also turns out that trust is hugely, hugely important in getting people to buy into new technologies. So if people don't trust the technologies that we're putting out there, they're not going to use them. We often, or a lot of the times, we design technologies by thinking of trust as a uniform construct, and we're not always considerate as technologists of the unique experiences that people have that informs trust. So this was kind of the dynamic that I was trying to understand, and especially as it relates to the kind of pandemic moment that we're living in, and specifically as it relates to contact tracing apps that are being used in Toronto, or not used, as we'll see, because they had super low adoption rates. So contact tracing apps. Contact tracing apps typically work by collecting Bluetooth data from users and then tracing back the people the infected person would have come in contact with. So for example, if I today became positive for COVID, I could enter that information into the app. It would alert all of the people that I had been in contact with using Bluetooth location data and send them an alert to be like, hey, you might have been in contact with somebody who was COVID positive, and then they can take the steps to self-isolate or do whatever. We know that contact tracing apps are hugely, hugely impactful when they're used correctly and when they're adopted. So a city that did this really well was Taiwan. They were particularly just so good at contact tracing. They had almost no lockdowns because they were so good at contact tracing. So they had no community spread, or almost no community spread. And that's because they were able to isolate the COVID cases and quarantine them or do whatever they had to do with them. And in that way, they didn't have as much of a need for lockdown. So if you look at how Taiwan looked for the past year and how Toronto looked, it was very different. And a lot of that is credited to good contact tracing apps. In Taiwan, there wasn't really a choice to download contact tracing apps. So if it was something that was mandatory versus in Toronto, obviously we can't mandate that everybody has a contact tracing app downloaded to their phone. So for us, we have to be really good at getting voluntary adoption. So a successful adoption rate for contact tracing. So in order for it to be effective, you need about 60% of the population to download the app. And we had, or the Canadian adoption rate in general, and it's about the same in Toronto, was about 12%. So clearly there's a disparity between what we needed and what we had. So the question then becomes, why was our adoption so low? Why didn't people want to download these apps? So the research that we have in terms of sort of like contact tracing hesitancy is taken from primary studies. So it included Canadian participants, but it wasn't exclusive to Canadian participants. But the countries that were included have kind of similar demographics to Canada and kind of similar like neoliberal policies. So it's easy to extend those answers into the Canadian context. And so what we learned from these primary studies is that people had a lot of unanswered questions. So how is the data going to be anonymized? Is it going to be anonymized? Will the data be shared with law enforcement? Will the data be sold for commercial use after the pandemic is over? These are not things that were clearly communicated at the onset of the contact tracing rollouts. So the second most cited concern that people had was user privacy and data concerns. So again, how are you going to make sure that my privacy is protected? How is my data going to be used? And then the first most cited reason for not downloading a contact tracing app was just a general lack of trust in institutions. And I think it's important to make the differentiation between I'm worried about my privacy and I just don't trust you, because they are two different constructs. And I think that it's a good lesson for data professionals to know, because if we can fundamentally get at the construct of trust, we can have more successful technologies. So again, like I mentioned, the context that I was kind of coming at this with was thinking about policing technologies. And so we know from researching other technologies like facial recognition that your personal experiences or the experiences of the people around you dictate your perception and how likely you are to trust in public institutions. So again, it's this idea of our lived experiences are going to impact that idea of trust. And that's not going to be a uniform construct for everybody, because everybody has different lived experiences. So from my research that I found was that this is especially true for Black communities in the United States, who are more likely to be the targets of police brutality and have been disproportionately harmed by sort of technologically enabled infrastructures like facial recognition or predictive policing. In the Canadian context, we know that Muslim communities have been disproportionately the targets of police surveillance since 9/11 and have been over-criminalized through surveillance. So lived experience very much depends on trust, it very much impacts trust, and we should be considerate that trust is not a uniform construct. So I think, hopefully, that there's a strong case to be made for designing for trust, right? I think the other thing that I learned by doing this research is that it's the communities who are least likely to be protected by other methods or other measures that have the most to gain from contact tracing apps. So racialized communities are the least likely to be able to work from home. So when we look at our labor force in general, we know that racialized people disproportionately make up sort of factory workers or service workers, people that can't work from home. So they're going to be the least protected by lockdown measures and arguably have the most to gain from good contact tracing. These are also the communities that are going to be the most impacted by privacy breaches. So when we talk about user privacy concerns, or when we talk about mistrust or data concerns, these are the communities who have been the most surveilled, they've been the most over-criminalized. And so if there were to be a data breach or a privacy breach or privacy that's not embedded into this technology, these are the communities that are going to suffer the most. And so I think there is a strong case to be made that we should embed trust and protection for these communities into our data models. So an example of kind of how data can be used to harm these communities is, in certain contexts, data that has been collected for public health has been combined with other demographic and socioeconomic data to create behavioral profiles to then categorize people into how likely they are to engage in police behavior, which is then led to being over-criminalized or over-policed. So we don't have a ton of information on how that happens in Canada, but it has definitely happened in the United States with things like predictive policing. And so I think that it's really important to protect against these things at the outset. And there is enough precedent for us to believe that these instances are not far-fetched, right? Like, it is something that could very much happen. I think that if you design a technology that is not considerate of sort of social and political nuances and the very real and very present stratifications that exist in our city, then we're not designing a technology that's going to be effective. It's also a public health concern, because I think if people are so stressed and are so distrustful of the risk of surveillance or over policing that they are not going to opt into a technology that is potentially beneficial, it not only causes a crisis of legitimacy for public institutions and for public technologies, but it's also not something that we can pin on the user. Like, it is something that I think as technologists and as policymakers, we kind of have to look at the systems and the systemic flaws that are causing for people not to trust us, and kind of recalibrate the way that we build and communicate data constructs. So another example of a way that data was just like not used in a way that it should have been was in Korea. So kind of similar to Taiwan, they had contact tracing that worked really well, but again, it was mandated, so you had to download the app. And so they were finding instances of that data being shared with immigration officials. And during the pandemic, undocumented immigrants were being deported based on the data that was found from contact tracing apps. Another instance that I just thought was like kind of interesting, in Bahrain, which is a small country in the Middle East, and it's a Muslim majority country, they were using contact tracing apps during the holy month of Ramadan to give prizes to people on a game show, so a nationally publicized game show. So people who stayed home the most got these prizes and were kind of publicized on national TV. Again, not super sure if we should be using public health data to have a game show that people didn't opt into, which is kind of something that happened. So it's just like interesting to see how data is used for different purposes. And we'll talk a little bit more about that in a bit. But to just illustrate this a little bit more, so this is like fully hypothetical, but say we had two users. So user X and user Y. User X is a Canadian citizen. She's a student who lives and learns remotely and lives alone. And user Y is an undocumented person who works in a factory, therefore they can't work from home and lives in precarious housing. If both of these people were to download contact tracing apps, and there was, for example, wasn't privacy embedded into the model, or there was a data breach or something along those lines, it's kind of clear which one would have the most to lose, right? So the Canadian citizen who lives alone and learns remotely probably has less to lose than somebody who is an undocumented person, has precarious housing or precarious citizenship, because we know that these communities have been over-criminalized. And this is obviously going to impact how likely they are to download a contact tracing app that is literally collecting their data. So that said, there is a lot of research to show us how to design for trust and the best practices that we can learn from and think of from other countries or different models that have been successful, especially in the neoliberal context where adoption is going to be voluntary. There are different models that can still be effective. So we can actually encourage people to opt into these technologies without some sort of mandate or coercion or that kind of thing, if we learn to build trust into these models. So the two models that I looked at primarily was a model of third-party governance and a government-owned model. So a model of third-party governance is where a third party owns all of the data, and the data is only shared with government agencies once it's been anonymized. So there's also sort of, which is beyond the scope of this presentation, but there is an argument to be made about public-private partnerships and how we can leverage them to be useful when we're trying to build technologies that are trustful. And again, so this would be, we hire someone, they take care of the contact tracing bit of it, and then they only give the data back to the Canadian government once it's been anonymized, so that the government still has access to that data for public health statistics or that kind of thing, but they don't own any of the personal data. The second model is government owned, and this is like following the Euro model. So the government still owns and collects all of the data, but there are very strict laws and governing practices in terms of what they can and cannot do with that model. So some examples would be, for example, you can't share it with law enforcement, you can't share it with immigration. And I think the European models are a little bit better than we are at having policies and privacy regulations that are embedded into their technologies, and they're a little bit more considerate of that. And as a result, they have higher adoption rates than we do. There are also principles that we can follow and make sure that when we're designing technologies or when we are collecting data from individuals, we're mindful of these things. The first one is transparency. I think that transparency is really important because you have to communicate to people exactly what's going to happen, right? So we can't take their data from them under the guise of public health and then use it for some other use unless we're being transparent at the beginning and we're giving them the option to opt in or opt out. Then again, if we really do want them to opt in, that's something that we should be considerate of. Another thing is clear communication. So all of us, or a lot of us in this room, are students or professionals or academics, so we have a better understanding of data than the average person, right? So we have to clearly communicate these constructs in a way that is not opaque and that doesn't seem impenetrable. I think technology can be really daunting to some people, and they don't necessarily understand everything that's happening behind the curtain, and that leads them to kind of just shy away from it, right? So I think if we communicate really clearly, and of course, like the data supports that, or the research supports this, we will have higher adoption. Then specific to contact tracing is ensuring that the data is collected for single use. So that would help us to avoid the risk of surveillance or over policing, because if we are collecting a data for a specific use, we are then only going to use it for that purpose. And I think, again, if people just broadly don't trust systems enough to opt into the right parts of it, this is a way that we can ensure that their concerns are kind of alleviated. And again, like, these kinds of flaws are not really necessarily on the user at that point, right? So we kind of have to consider the way that these are systemic flaws. And I think single use data is one way for us to think about, okay, people don't really trust us. Here's a way for us to make that better. And then lastly, one of the things that I considered was just understanding the limits of participatory design. So participatory design is the notion that we should include marginalized people into our technology development and design. I think that is absolutely true. And I think that there is definitely a place and room for stakeholder engagement. But I do think that, especially in the context of a pandemic, we should really understand the limits of participatory design. And so what I mean by that is, if we have communities, like I mentioned, that are being hit the hardest by this pandemic because they can't work from home, or they disproportionately make up segments of the labor force that are the least protected, it can create an additional burden to then insist that we include them in designing a technology that is already kind of flawed against them, right? So yes, there is room for stakeholder engagement, and I wouldn't discourage that, but I think it's really important that technologists and policymakers are mindful of the limits of participatory design and the way that we can actually create additional burden for people when we're not mindful of those nuances. So that said, I will just leave you with a quote, which I thought was really important and kind of like summarized everything that I learned in the past couple months. And it says, "An inattention to the specificities of local politics and the power relations among the multiple stakeholders involved in development project often contribute to the increased marginalization of oppressed groups while further entrenching existing power structures." I think that I have found this to be especially true in the context of contact tracing apps in Toronto. And it's something that I've learned to be mindful of. And yeah, I hope that that was informative and useful, and I will welcome questions.
Thank you so much, Kamilah. As always, so articulate and clear. A great presentation. If anyone has any questions for Kamilah, you can raise your hand or put it in the chat and we'll call on you. We do have one question to start off though. What are some books that you recommend everyone read?
Yeah, so I knew you guys were going to ask me this. So I have the only important book, which is R for Data Science. No, I'm totally kidding. That is one of my favorite books ever. But I think so. It's interesting because, like Loretta mentioned, my background is in economics. And I think making the switch to more tech-oriented studies was a little bit daunting for me. But I read a book a couple months ago. It's called Range by David Epstein. And it's essentially about how being interdisciplinary and having a multitude of backgrounds working on the same project is actually super beneficial. And I think that that's very true when we're designing technologies for public use, because you need people who understand more than just the technical constructs. So you need people who understand sociology, you need people who understand urban infrastructures, you need people who understand sort of racial makeups and stratifications in a city. So yeah, it's called Range by David Epstein. Another book that was recommended to me really recently that I haven't actually had the chance to read yet, so like that's my caveat, but it's called Decolonizing Methodologies. And apparently it's been around for like 10 years, but it's basically about, again, like the limits of participatory design and how to make sure that our methodologies are inclusive and considerate of different people and different things. So that's like on my reading list. I haven't read it yet.
Very nice. I'll find a link for that last one. The link for the first two is